Good morning, everybody. I'm Dr. John Willardson, and welcome to Trust Implants live stream here in beautiful Newport Beach, California. I've got my assistentes here, Dane, my wonderful son, and Memo, pretty much my son. Grateful to have them here with me today. We've got a great show for you. We're going to go through and look at some cases and talk about the world of, last week we talked about frequencies and how when we do certain things to help ourselves, whether it's go to the gym, whether it's semi-glutides, whether it's fixing our teeth, our smile, our mouths, it really affects our frequency and how we present ourselves to the world. And so I had a Zoom call consultation yesterday with a patient, and she lives up towards Fresno, actually. And after talking with her and kind of, as the doctor, I get a sense of their frequency and where they're at. And I could sense that she was pretty down. Not to go into too many details, but basically she was not leaving her house. I mean, she's like, she had her teeth removed about a year ago. And since that day, she has she said, it's like her world kind of fell apart. So, and I see this quite often. I see this with a lot of patients. By the time they get to me, if they've gotten to the state where they're losing all of their teeth, or they've lost their teeth, or they're just uncomfortable with their smile, they're not smiling anymore, they're not presenting their best face forward, their frequency changes and they suddenly kind of lose where their purpose almost. And I could sense this with this patient. I could sense that her purpose was lost, and a lot of it was dictated towards her smile. So today I'd like to talk about that a little bit and just kind of help, let's delve into the idea of what are some things that we can do to make it so that we present ourselves best, our best face forward, and are able to kind of take on the world without having this limitation. And our smile and our mouths are such a big part of us and how we present ourselves to the world. So here's a patient, just to kind of look at again the idea of the frequency. Here's a before photo, and of course we show a lot of before and afters, but it's a matter of when we first meet the patient, and then, once we do their case, all of a sudden the shift has taken place. They're able to present themselves to the world. This problem that was such a big problem for them is really no longer a problem. And so, and it starts kind of, it starts slowly. For example, if a patient who is having lost maybe one tooth or a couple of teeth, and all of a sudden the wear and tear starts to occur, and the breakdown starts to occur, and especially on their front teeth. And this, again, I go back to the factors of the load and how the distribution of load is taking place throughout the mouth. If it's evenly distributed throughout the mouth, and we've taken the load off of the front teeth, then it's going to protect those front teeth. If not, like in this picture or this picture here, a person will literally wear down their front teeth to where this was a surgery I did. I extracted these uppers. I think it was last week, but you'll literally get to the point where you will wear down your teeth. That's how strong the masseter muscles are. That's how strong even in our mind, if, for example, if you were to, our teeth are so sensitive, and the feeling of the proprioception, I talk about that quite a bit on our live stream and on YouTube. Proprioception is if you were to floss your teeth and get a tiny little piece of the thread of the floss stuck in between your teeth. In your mind, it'll drive you crazy. Or if you get popcorn kernel or something stuck in between your teeth, until you get that out, it's like you will not be able to focus on much else until that comes out of your teeth for most people. Now, there are cases and there are patients where they don't have that, and they don't worry about stuff stuck in between their teeth. And that those two kind of need to worry, because eventually they end up in situations like this where there's a lot of debris in between the teeth. They're not very clean. A tooth breaks off. They don't do anything about it. There's decay. They're not subconscious about it. They don't. And every personality, every person's different. But once it gets to a point such as this, now we're looking at, extracting everything. This was actually from a few years back, but I did this exact surgery yesterday on a patient. And I want to talk about that because it's an interesting case. But here's, the after photo. And again, you can see from where he started, here, and I do have a before shot, but you can kind of see where his mouth was and to where he's at, today, and a complete shift. And also, at this point where the patient has kind of just given up. They've succumbed to the fact that, my teeth are falling out. I have broken teeth. My mouth is in complete disarray. And so, what's the point? What's the point of brushing, flossing? And I hear this quite a bit from a lot of patients. They reach a certain point after they've lost 1 or 2, 3, multiple teeth. The bite forces have now shifted. The load factors are all over the place. They're wearing down their front teeth. And so at a certain point, they just kind of go, you know what, I give up. And then it leads into, so now what? And where do I go? And what do I do? And how do I solve this? Do I need to solve this? Am I just going to end up in dentures, like my grandma was? And so then, ads start popping up on television. You'll see an ad for, one of these corporate all-on-4 centers where you just get 4 implants and a plastic prosthesis. They may end up in a place like that, and a lot of times they're successful, but oftentimes they're not. Every person is kind of, they reach a point where they are in a situation. If they get to this situation, they are kind of left to the devices of, sometimes marketing, sometimes, hopefully they can get a referral from a friend who's been through the process. So, it's hard to say exactly how people navigate through it. But for patients who, that's for natural teeth. So if we look at natural teeth, what happens if they're not maintained, and the level of bone loss, decay, fracture of the roots or the crown of the tooth, that occurs most definitely. And I get a lot of, I'll get questions from patients who will say, I just want to have my teeth pulled because then I can have implants and then I don't have to worry about it anymore. I don't have to floss. I don't have to irrigate. It's going to solve the problem. And for a patient like I just showed you where those teeth have to come out, that certainly is the case. However, even around implants, if they're not maintained, if you don't brush, if you don't irrigate, if you don't floss, you will develop a level of bone loss similar to you would around natural teeth. And so these are just a few examples of, cases where, but this also, when I look at these radiographs, the quality of this implant here is not great. So I don't know if it's an issue of lack of maintenance or if it's the titanium, because this is a titanium alloy implant. It is not commercially pure titanium. It's an alloy, like we've talked about on our live streams, is a mixture of metals. So you've got, maybe it's 85% titanium, but then you have nickel, you have palladium, you have other metals that are mixed into that titanium. And oftentimes the patient could be allergic to nickel. And if there's nickel in the implant or in that alloy, even if it's 0.5% or 1%, that can cause a retraction of the bone. The bone can pull away from the implant. So, it's hard to say, but that's why, it's important to go to a reputable place that uses one standardized system and hopefully a commercially pure grade 4 titanium implant. So anyway, so, there's so many variables and factors that we have to consider, that patients need to consider when having this sort of work. Again, here's another before, same situation. And it's very common that I see this is the loss of the back teeth. All the load factors are then transferred to the front, and then the breakdown of the front teeth, and then it's a matter of, okay, are we going to pull everything? Where do we go from here? And so, in her case, we ended up extracting the upper teeth and then doing all on 6. Actually, I don't know if it was all on 6 or all on 8 on the upper, fixed zirconia prosthesis. Then we restored the lowers. And so that's important that the entire mouth is reconstructed, because we need control over the load. We need to make sure that the bite and the forces are evenly distributed throughout the mouth. And we did talk about this last week on our live stream. Here's a case just pulled off the internet, but they did the upper, but they didn't consider the lower. When I look at this lower and I see, an old crown here with, this crown's got to be 30 years old. And then same thing back here. And not factoring in the entire mouth and reconstructing the mouth so that everything articulates and the load factors are ideal and perfect. It's really important that when you do this sort of work, or when you need this sort of work, that you understand that the entire thing needs to be done. Here's the x-ray of that case. Obviously, it's an all-on 4. And, there's no tooth back here to support this molar. It looks decent, but there's a lot of things that were missed in this situation that could have idealized and made the investment for the patient more ideal. So, here another x-ray of an all-on 4. All the implants are concentrated in the front of the jaw. There's plenty of bone back here that implants could be placed. So there's no reason to not place implants back here. Here's a CT scan of one of my patients that we transferred. It was an all-on 4. We reconstructed the case with all-on 6, give more support in the back of the jaw. And you can see back here those implants are supported. I've got good load support back in the very back of the jaw. So I'm able to put teeth way back there. So anyway, so those are just some pictures before and afters. But I'd like to kind of turn over to Dane and Memo. And last week for my son Dane, he had some bite issues. We need to make some adjustments too. And I don't know if you're okay talking about this, but
before that, we have a couple of questions.
That
need to be answered. First one is, I'm a diabetic person. Can I still have dental implants instead of my dentures?
Oh, great question. So yesterday, again, I was going to kind of talk about that surgery I did yesterday. So I had a case yesterday where the patient was diabetic, was on Eliquis, which is a blood thinner. She had a laundry list of medications. So, she had been told by other practitioners, you're really not a candidate. And she was older. I think she was 83 years old. But as I consulted with her and met with her, she kept reiterating to me that, I'm just uncomfortable with my smile. I am, when I have family dinners, it's affecting me. It affects, it's that frequency thing, right? And as I was consulting with her and listening, kind of to the family, but also to the patient, I had this impression, this is an important thing for her. And we need to really, understand, are you a candidate? Is this going to work for you? Because I certainly don't want to do anything that's not going to work. So after reviewing her CAT scan, looking at the CT, and because when a patient when they're diabetic, they're predisposed to other issues, right? They have a higher chance of failure for the implant, just if their blood sugars are uncontrolled. Hers is pretty controlled, so that's really not an issue as far as I'm concerned. If it's controlled and they are, on top of that. Now, if it's totally uncontrolled, it's obviously their teeth are important, but more important is they get that under control. So somebody who is diabetic definitely is a candidate, but uncontrolled diabetes, we need to get the diabetes under control, and then from there we can, and that doesn't take much. There's, like with semaglutides and Ozempic, I mean, it's been remarkable to see the effect that's had on the diabetic community. It is a very great drug to treat patients who are diabetic, and then also for weight loss. So. But yeah, definitely. That's diabetics are absolutely candidates, especially when they're in a controlled situation.
Okay, so. Perfect. And then last question, for now, doctor, an elderly person that has lost all their teeth, can they still get full dental implants? So I'm guessing they're wondering like what
age range, I guess.
Yeah.
Yeah. So age is not a factor. I mean, this was a long time ago, probably 15 years ago, but I had a patient, oldest patient I did, and nicest guy. He owned a beverage distribution company in the Inland Empire, and just the sweetest guy. But he was 92 years old, and by the time he got to me, he's like, I don't care how much it costs. I don't care how long I live. I want to be able to enjoy a meal. Who knows how many days I have left, and that was his thing. And I'm like, you know what? Absolutely, let's do this. And we did it, and he loved it. And it transformed his, again, I mean, not to keep beating, the frequency thing, but it transformed his frequency. He, when I would see him on follow-ups, he's like, oh man, I love this. I can eat again. I got my confidence back. And he was a successful, energetic guy, even at 92. I mean, he was out there hustling, So age is really not a factor. The surgery that I did yesterday, she was diabetic. She had been told that she's not a candidate. She has osteoporosis. All of these things that on paper you'd look at it and you go, you know what? Yeah, I don't want to touch this case. But after reviewing her CT scan, looking at the density of the bone in the CT, obviously I didn't look at the long bones because that's where they gauge osteoporosis. And, once I, was drilling into the bone, it was hard. I mean, it was very, very hard, the bone that I was drilling into. So I question whether or not she really and truly was osteoporotic, because in her maxillofacial region in her mouth, there was no osteoporosis there. So I do treat each osteotomy or hole differently. I had to do some extraction, so I pulled a few teeth and prepared the ridge, and then placed the implant. So, but in each osteotomy or each hole, I had very good density. Some were a little softer, but so in that case, when the hole is, or I feel, maybe this bone is a little softer than what I'm getting like in the front of the jaw, I'll under prepare the hole. So for example, and I've talked about this quite a bit, but on one of the sites, I had 70 Newton centimeters of torque on all the implants except for one. I had 50, and that's high torque values. If I have 20 or 10 Newton centimeters of torque, that's a low torque value. So on one of the sites, it was like 50 Newton centimeters, but I sensed a little bit of softness in the bone as I was drilling into it, and with that, the aperture of the hole of the osteotomy, I stop shy, so I make the hole smaller, and then I drive in a wider implant. So I put in, I stopped at like 2.8 millimeters, but I put in a 5.0 millimeter implant. So, but those are clinical decisions that I have to make as I'm doing the surgery that will allow me to engage that bone better. So these are just little factors that come up as I'm doing these cases. But
yeah, that's great. So that same person said, thank you very much for the attention. And then going along with that question, the person that they're talking about, they're in their 60s, smokers, but good health. So Would they still be candidates?
Yeah. Okay. So good health, 60-year-old, that's young, I would say. Smoking is a big factor. If you were to have, I've had in my over the years broken many bones and have a lot of hardware in my ankles and knee surgeries and shoulder surgeries and all kinds of stuff from some of the activities that I enjoy. But for somebody, let's say you're having a knee replacement, because we get a lot of patients that have a knee or hip replacement or something. The surgeon, the orthopedic surgeon, is going to be very adamant about no smoking. And why is that? That's again, I've talked about this in other live streams or on YouTube. It's an indirect effect. So the smoke is indirectly affecting you're implanting a foreign titanium object in the body. Surgeon is going to be adamant about no smoking on an indirect effect. So it's, again, indirectly affecting the knee or the hip or whatever. Now, if you translate that into the mouth and dental implants, we're doing the same, technically, osseointegration, which is the integration of titanium to the bone to titanium. If the patient continues to smoke, that's a direct effect and a direct attack on the surgical site. And so that is why smoking is, I say, very contraindicated. Have I done cases on smokers? Of course. Sometimes they stop. There is a smoking cessation protocol. Way back in the day, they would say stop smoking for 2 months before surgery, 2 months after surgery. But, if somebody's going to take the time and in the investment in doing this sort of thing, hopefully they would stop smoking to protect their investment. And it's the best thing, not only that for their investment in their mouth, but just in their overall health, So, but, it's not a complete contraindication, but it definitely, I have to think twice if I'm going to do the case, if they're not going to stop smoking.
Yeah, of course. All right, so far those are all the questions that we have. I think we were going to turn the time over to Dane.
And thanks for asking questions. We love the interaction. So,
Definitely.
Yeah. Anyway, so excuse me. I had had a problem where I was grinding my teeth. So I'm going to school and I'm working. Stress load's a little bit high occasionally, and my body has mitigated the stress. I started grinding my teeth, and I didn't even really know it. At night, I was grinding. I'd wake up, my mouth's a little sore.
Was your jaw sore?
Not really, but like my teeth felt sore. You know what I mean? Like they'd been through the ringer that night, because after a full 8 hours of grinding,
you cannot control that. Like if you're grinding your teeth at night,
it's totally subconscious. I had no idea I was even doing it.
Nothing you can do other than make an orthotic or something to protect your teeth, a night guard.
Right, which luckily, doctor did make me a night guard, and he was able to fix it to some degree. But my teeth were wearing down. My incisal edge, in your words, was completely worn. It was like so.
And by the way, his teeth are absolutely perfect, but this wear and tear was
Yeah, it was bad, and it was uncomfortable, and I noticed myself to a certain degree. So I've worked here with the doctor for a couple of years now, had a lot of experiences with patients as well, but I've never felt the same feeling of like, oh, I'm self-conscious about my smile. I've never experienced that before. And for a little bit, with the edges broken down, like my teeth looked kind of chipped, they looked uneven, like, I had tried to eat through a screw or something, because it was all like, and so for the first time in my life, I felt insecure about my smile. And so if someone looked me in the eyes, they looked down at my mouth, that's a normal thing to do, lip reading, whatever. But for the first time, I was like, dang, I wanted to cover my mouth. I'm like, are they looking at my teeth? Do they notice that it's broken?
They were judging you because you knew subconsciously in your mind there was, and they for sure were not.
Yeah,
but just that small little thing of having a chip on the incisal edge of number 8 or number 9, because you knew it was there, subconsciously you're kind of like, oh, I'm being judged right now.
Yeah.
And so every interaction, whether it's somebody at the grocery store, at a 7-Eleven or a Starbucks or whatever, like every interaction, that's a subconscious thing that is affecting your frequency, right? Like
right, totally. And so, luckily he was able to, it was a quick fix and everything, but I felt on a 1% scale what people feel when they lose their teeth or if they have a smile that they're not confident about. And it totally, frequency thing again, it totally changes the way you feel about yourself and the way you think people look at you and perceive you, which whether or not it's true, you'll never know, but the way that you perceive it is how it's going to make you feel, and that's how it's going to affect you. So I felt on a small scale for the first time the power of having confidence in your smile, and so that was really interesting for me to be on the other end of it.
On the other end of the spectrum, yeah. Because and of course his situation was very minor, took minor adjustment, was able to, but what was happening, or what happened was, and this was an orthodontic issue. So oftentimes the orthodontist will move the teeth to where they look good, but if they're not concerned about the occlusion or the bite and the forces of the bite, it's going to break down. Again, our mouths and our musculature, the masseter muscles, our subconscious mind when we're asleep is a lot stronger than our teeth. We will grind through, if the occlusion and the bite is not absolutely perfect, we will grind through the incisal edge of our front teeth in a matter of, not too short of, or in a really fast amount of time. So that's why I keep reiterating the load distribution and having the occlusion, the bite, everything has to be spot on in order to protect the long term, whether it's a fixed implant prosthesis or perfectly good natural teeth. That load distribution has to be absolutely perfect. And so sometimes, an orthodontist may, the orthodontist that did his case, he worked in different offices. He would, go around from one office to the next. Didn't have his own practice, so he's just kind of working for somebody else. And I think, and oftentimes maybe just get a little bit lazy and not really put in the effort that needs to be taken in order to, or maybe they don't understand it. I don't know, because I don't know the mindset of other practitioners who are doing this sort of thing. But it's very important that the biomechanics are considered, whether you're doing orthodontics or you're doing implants or whatever the case may be, or full mouth reconstructions. It has to be considered. Otherwise, whether it's crowns or natural teeth or implants, something's going to give. The bite, the bone structure, the masseters, and your subconscious mind are way too strong to withstand the forces that are going to occur as you're doing your daily activities with your mouth. So, but yeah, no, I appreciate you sharing that story, because it's not even 1%. It's probably a 0.5%, but you got a small taste of what some of these patients are going through.
For sure. And not fun.
No, yeah. So, and again, kind of as I was talking about the consult I had yesterday, the patient up north, she's basically locked in her room. She is, she says, I really don't leave the house, and it's been since they've done the extractions, and now when I was on the Zoom call with her, she didn't have anything in her mouth. I don't know if she's wearing her dentures or not. But what happened was her insurance was not going to cover what's called an alveoloplasty, which is, the alveolus is the bone after the teeth are removed. So when the teeth are out and you're looking at the bone that a denture sits on, that's the alveolus. And for some reason, the doctor who was working with her was really hung up on the fact that the insurance was not going to cover the alveoloplasty, which is smoothing and contouring the ridge. And rather than look at the patient as a person, like, okay, what is the problem? This person's not leaving her room. Like, she is literally paralyzed. And focusing on the fact that, well, the insurance isn't going to cover the alveoloplasty. I do an alveoloplasty pretty much every single day. 99.9% of the time, I don't even charge for it. The goal is to give the patient what they need, get them implants, restore their mouth, restore their frequency, so that they can move on with their life. It's just a matter of priorities and prioritizing, because I do run and maintain and have my own practice. I do look at each patient individually. I do not overlook important things like occlusion, biomechanics, and how the articulation is. It has to be perfect because that falls on me. I can't pawn it off on the owner of the practice who's giving me 20% or 25% of the case, and then move on to another practice where I get another 20% or 25% of another case. And I'm not vested in the patient, if I'm doing that. Whereas in my practice, I'm vested in every single step that I take on every single patient that I see, and that's, it's just, I think, a very important aspect of the process.
Yeah, and we wanted to go over something that we got on our car, marketing material. I don't know if you guys know, Memo and I, we work on the marketing team, for those who are unaware. And so we think about constant ways to reach new patients because we know the value of what it provides. But yesterday, one of the guys that we work with got this put on his car. It's just like a print ad for, in fact, he does fast braces, complete exams, home whitening, crowns, dental implants. So this guy is the equivalent of, you go to a foot doctor and you leave with a shoulder surgery. Like he's kind of marketing everything, taking advantage where he can. And so we've blotted out the names here because we don't want to bash on anyone, but it's just the idea here that we wanted to touch on that's really interesting. And it goes back to what you were just saying about taking care of patients individually and understanding that everyone has a need. So here, this is what we like to call a classic bait and switch. So I don't know if you can see here, but it says dental implant, abutment, and crown, $1,900. You're like, oh, that's not bad. Like, heck yeah, I can do that. That's easy. That's affordable.
So that's one implant.
One implant. And in tiny, tiny fine print, of course, they bold the 1900 and do size 2 font for the does not include CT scan, extraction, bone grafting, membrane, interim partial denture, and all these other limitations, plus an expiration date. So
if I were to break down like the cost of the CT scan, generally I don't charge for that, but it's in theory, insurance will pay about $750 for a scan.
Okay, so we're at $2,650. What about an extraction?
An extraction is $450, depending on the type of extraction.
Okay, $3,100.
Bone graft is $750. Membrane is $450. So
$3,850. We're upwards of $4,300 here for a single implant.
Right, and that's and that's for a back tooth. An anterior tooth or a front tooth is a lot more expensive because I have to make that tooth look like it's supposed to be there and not like it's an implant.
Yeah.
So.
Yeah, and we've worked in marketing for a while now, and so we see, just like there are the doctors that are, trying to get you in and out as soon as possible. There are marketers that are going to bait and switch you. They're going to use shady tactics to get someone in the door, and then that's not at all what the people are going to receive. And so this stuff kind of frustrates us because we do, we try hard. We focus on education, and we know the value of the procedure that Dr. Willardson provides here. It's total expertise, 20 plus years of experience, plus the ultimate training, plus failed cases are essentially zero. So you've done this countless times and they're not failing. And so that's what we like to push. Where someone like this, when you're just pushing $1,900, that's like the equivalent of BMW coming to you saying, all right, M3, $30,000. Okay, then you pull up to the dealership and they're like, actually, yeah, the MSRP for a 328i is $32,000, but if you want the M3, there's $100,000 of packages that you're gonna have to place on top of that. So it's it's false advertising in essence. So it was really frustrating.
Yeah, no, right, and kind of like what Dane was saying is we always try to find ways to really educate the patient. That's why we have these live streams, right? Because we are committed to every week getting on here, and we make sure that patients understand what we do, how we do it, and then why we do it. And we also understand that times are a little tough right now with the economy and with everything that's going on. And that's why you as a patient, as a consumer, not only for dental implants, but I would say for everything, you really have to educate yourself. Don't just trust everyone, because like Dane was saying, this is a flyer that it's screaming desperation, right? And that's what salesmen do when they really want to get a sale, right? When they want to get that money, is they just offer the most desperate offers that aren't really legit, to, like Dane said, to clickbait you into doing these things. I actually have something interesting to share. because here in our podcast, we like talking about the what we do and the how we do, right, Dr. Willardson?
And the why.
And the why, which
Yeah.
is the most important part of everything, right?
Yeah.
It's the why of why do you get the BMW, right? Or why do you go to that place to eat your favorite meal or anything? And there's so many benefits from getting dental implants that we see our patients go through. One of them could be like they can eat whatever they want, right? Another one is they restore their confidence. One that I was doing a little bit more research on last night was just smiling, like the importance of smiling in our lives, in our health. Like this is something that we've known for years. It's not something that like anyone can look this up, look it up on Google or anywhere, just type benefits of smiling, and there's tons and tons of research and studies that show, and they've done studies on people that are mad and then they change their mood to smiling, and how that changes. Elevates their mood, their energies, their frequencies. And this is kind of interesting here. It says research shows that children smile an average of 400 times per day. That's quite a bit, right? And that, children are always happy. They have, like we say, good energies, good frequencies.
They don't know negative energies yet.
They don't.
Over the weekend we were with my granddaughter, my oldest son Zach and Hallie, their little daughter Winnie, and she, like, her innate nature is to smile. That's just what they do. They don't know that the world hasn't come at them hard enough enough to know that there's a reason not to smile. Like when you were feeling self-conscious about, not even an issue, but a minor chipped tooth, that's like almost a reason to kind of withhold your smile or withhold your true self, I guess.
Yeah, no, exactly. And I guess you could say that kids are 100% confident, right? That's why they're always smiling. You bag on them and they smile at you. Like anything you say and do, they just smile at you, right? And that's why they're so happy. So 400 times a day, children, right? Compared to the average happy adult who smiles 40 to 50 times. That's
in a day.
In a day. That's you go from smiling 400 times when you're at your peak, right? Peak energy, peak frequency, just smiling all day long, to it's a happy adult 40 to 50 times per day. Mm-hmm. And then the typical adult smiles only 20 times per day. And that's an adult with, teeth and a smile. So now think about our patients that don't have teeth, maybe once. Sometimes they haven't even smiled for weeks. And
oftentimes, they when they do smile, they try to cover it. They'll use their hand, or they'll use their lips. They'll adjust the musculature in their face to not show their teeth, but still try to smile. And that is a very limiting. I can't imagine how that feels. Well, so it's almost it's a handicap for sure, without a doubt. It's definitely a handicap.
Something I want to add is what comes to mind when you talk about, covering a smile with your hand or your lips. There's a lady that we see every day at a gas station near our house. She could not be kinder, nicer, and we've gotten to know her pretty well because I live in a town. So I go to school up in Utah. I live in a small town. There's not a grocery store. There's a grocery store 10 minutes away, but if you just want a water, you want a drink, whatever, much easier to just go up to the gas station. Yeah. And so we see this girl all the time, and she has shared her life story with us. She's gone through her struggles and stuff that has affected her teeth. Her mouth health is struggling, and she is so kind and so happy, but every time she smiles, it's like this.
She covers.
She covers with her lips and with her mouth, and you can tell that naturally, like, her body wants to smile and wants to.
But she's not letting herself.
But she doesn't let herself. And I've always said, like, if we get to the point one day where we can give free implants, like, I want to fly her out because she seriously is the best person. And it really is painful to watch someone not.
It really is, yeah.
Like, not be able to enjoy themselves fully because of their smile. And so that's what comes to mind, but that's an interesting fact.
Yeah, no, and it's interesting because I think might have been 2 live streams ago that we talked about that when we see our patients get their dental implants, their final prosthesis, they just want to. It's like
radiating. Yeah.
They want to show it off. You want to smile it's like, why would you buy a brand new Porsche and leave it in the garage, right? It's, you want to go out, you want to take it out, you want to step on it, you want to hear it, and that's the same with this. It's just smiling, getting you smile. It's going to help your health, reduce blood pressure. It says here, reduce endurance, reduce stress. Just so many great benefits in their lives, but then also in the lives of those around them. Right. Like their family members are going to notice that. Their accountants, your coworkers. It's just gonna brighten up everyone around you. Yeah, pretty much.
We talked about that last night. Just
Your
the fact that
influence is very deep. You don't realize it.
Yeah, it's totally true. And something that, we've talked about financing a little bit last week. Something that I wanted to touch on that I don't know what the knowledge or understanding is of our average viewer or listener is 70% or more of patients have to finance cases. And so we talk about being able to finance and that we provide the opportunity and providers who can finance cases. It got me thinking, I'm like, do people know that it is uncommon to pay in cash? And so I just wanted to touch on that today as well, because before we finish up here pretty soon, that 70% or more of patients are financing cases. So we understand that the cases are high ticket items, and no one expects you to walk in here with $60,000 cash in your pocket, $40,000, whatever the procedure costs, So we want to work with patients, and like we've talked about today, we see true value in what we provide and what you provide. And so we want to provide every opportunity to make this possible. And financing is one of those things. And so I just thought that was interesting. 70 to 80% of cases are financed.
Yeah, I mean, it is, by the time I'm actually working on a patient, they understand, appreciate, and they value what the end result is going to be. And so, financing it's an important part of the process. The value that, and I've said this, if I could, when I have a new patient consult or whatever, I'll tell them, if I could put this in your mouth for a day and have you come back, put this in your mouth for one day to try it out, they will literally come running back to me saying, okay, well, what do we have to do to get this done, And so, the barrier to entry, like in everything, is obviously a lot of times it's the financial aspect of it. I try to create treatment plans for every budget and try to help as many people as I possibly can. But a lot of times it does require them to obtain financing to do the case, which obviously that's a big factor. But a bigger, more important factor is, and these are just notes that actually Memo had made, and I want to kind of bring this up a little bit. Back to the issue of frequency, and he shared this with me yesterday, and we've talked about it in the past, but I've never kind of looked at it in this light. So, and he made this is just a written diagram, but if you'll notice, there's like a midline here, right in the middle, where between courage and pride. So if you're filled with pride, it actually weakens your frequency. And pride can lead to other things, because it can lead to anger and depression, and because everything is becoming internalized. I'm only thinking about myself when I'm in a prideful state, right? Versus going the opposite direction and increasing our influence. I don't know if you can read this, but it says a weak influence or increases as our frequency increases, our influence increases. And I just thought this was really interesting. Then all of a sudden we start to have courage. We're more willing, we're more accepting. Our reason is more realistic. We share more love. We're probably smiling a lot more. We ultimately have more joy, more peace. Now we're becoming enlightened. We can actually be enlightened by, God can enlighten our minds and our hearts. And then ultimately that is our true authentic self once we reach that highest frequency but at that point we are giving to everyone around us. You know, like the lady in the gas station by your house. I can be pretty assured that when she sees you coming in and you're buying your Monster drink or whatever, like your presence to her lifts her up. You know, your frequency lifts her up because she, you know, with the condition of her mouth or whatever life has thrown at her, her frequency is probably kind of low, you know, and to have your frequency lift her up and kind of brighten her day. And this, I'm just using that as an example, but there are, you know, when I see a patient who's, you know, their frequency is low, they're very self-conscious about their mouth, their smile, and their situation pretty much. Once we correct that and give them a little bit of that light, and all of a sudden it's like, oh, wow, you know, I don't have to stress and worry and this thing that has been weighing on me, like the consult I saw or had a consult yesterday with, I could sense it in her eyes, like this thing is just weighing her down to the point where she's not able to leave her house. And so, you know, and Memo is sharing this with me, like on the radio, you can adjust your tuner on your radio and you can listen to sports, you can listen to country, you can listen to rap, you can listen to, you know, whatever type of music, business, different politics. And those frequencies influence your frequency, you know?
Right.
And so when our frequency is low, if we can change that frequency like we can on a radio, and we have to take the action, we have to take that step and turn the station, the channel that we're listening to, so that our frequency can increase. And I love this topic, and I would love to just have a whole live stream about this. I mean, dental implants are great. We do amazing transformations, and it truly is a life-transforming procedure, and I love what I do, but I love what it does for others, which is elevate their hope, their joy, their frequency, their ability to, you know, how they feel about themselves. And so, you know, to me, that's the real value and benefit that comes from doing this sort of work, because, you know, by the time they get to me, like I've said, I mean, they're kind of like, what do I do? You know, I'm pretty down and out, you know. So, and the barrier to entry oftentimes is the financial aspect of it, which we do mitigate that. And once they've made the decision to okay, yeah, let's move forward on this, and once we get through the process, now they've gone from a very low frequency to a much higher space. So, you know, at that point, it's just a matter of maintaining it, you know.
Yeah, that's the why. It's the why you do all this. And that's, you know, your surgical techniques is to provide the best, you know, solution. And the why is to change their frequency and to change their life. So
absolutely, yeah.
Perfect. We have 2 more questions.
Okay.
This one, I don't know if it's relevant, but it's one of our viewers, so we're going to answer it, right?
Absolutely, yeah.
It says, I don't know whether it's relevant or not. When wisdom tooth got infected, what would happen if one decides not to extract, but always have this metallic taste and sometimes accumulation of like food particles?
Okay, so he's got an impacted wisdom tooth, and he's not extracted it. Mm-hmm. So if there is food impaction, like, well, anywhere in the body, if you had an open sore and you kept, you know, putting dirt into it, and for whatever reason you just kept putting dirt into an open wound, eventually it's going to get infected. The pH of that area is going to change, and that's the metallic taste. The pH of their mouth has changed. It's more acidic because there's some infection. I think I'd have to see an X-ray, obviously, but because the pH has changed, because there's a chronic infection, they're going to have like this metallic taste in their mouth. So my advice would be to, you know, see somebody to have that wisdom tooth removed. It's a very easy procedure to do, fast. I mean, take you 5 minutes to extract a wisdom tooth. So it's, you know, it'd be important to address that, especially if they have a metallic taste in their mouth, you know.
Yeah, of course. Yeah, thank you, doctor. And feel free to ask any questions. I mean, if we can't answer them, we'll just say we can't answer them, but at least you ask. The last question is, are all-on-6 considered hybrid, or is that something different?
Okay, that's a good question. A hybrid is the prosthetic I'll show, this is a picture of a full zirconia prosthesis. So this is not a hybrid. This is it's a block of zirconia that's milled with our milling machines. A hybrid is a titanium bar, and I'd have to go back to a titanium bar that's wrapped with plastic. So a hybrid means that it's a hybrid between titanium and plastic. And I've got a picture of a hybrid here.
So does it really come down to the place that you go do it at? Because they could do all-on-6 and keep it hybrid, right?
It could still be a hybrid. So here's a picture of a hybrid that's broken. So this picture here is a fractured metal acrylic prosthesis. I just pulled this from the internet. Metal acrylic means that it's a plastic denture teeth and plastic acrylic wrapped around a metal or titanium bar. So that's why they call it a hybrid, because it's a hybrid between two materials. And here they made just a new hybrid. It looks a little better, but on this photo, and this is where I get into, the biomechanics, to go through all of this work up on the top and then to totally neglect and not deal with the bottom, because on his lower I can see he's missing his molars back here, and this also is a prosthetic. He's got implants on the upper and the lower. And so, but to do all of this work but not treat the lower and give him a full complemented smile. Plus you can see the color discrepancy, the color of this versus that, and the wear of his lowers is very different. Whereas had you done both top and bottom together, one, you're going to make the mechanics of the whole system work a lot better. Aesthetically, it's going to be better, and it's going to be a lot better investment for the patient. But to answer the question on the hybrid, it's just a hybrid between two materials, which is metal and plastic. And so you can do all-on-6 hybrids. I don't do those. I only use zirconia. I haven't done a hybrid for probably maybe 15 years. There's no reason to do a hybrid today other than it's cheap. That's where you'll get at like a corporate all-on-4 center is a hybrid. It's very inexpensive. They can do them really fast. But the long-term, you'll see the fracture of them pretty prevalent.
Awesome. Thank you, doctor. That's all the questions that we have so far. I do want to mention that if the viewers could help us out by liking the video, that's going to help the algorithms quite a bit. So what that means is YouTube's going to show our videos or live streams in front of the people who've been searching for dental implants. That's kind of how marketing works, right? I'm sure everyone has talked to someone about something or looked something up, and later they're scrolling on Facebook or YouTube and
pops up on your
and
phone.
you get an ad and you're like, what? How are they listening to me? So that's how it works. So if you could subscribe and hit that like button, it's just going to help reach the right people. So then those people don't make mistakes by going somewhere where they're going to get the treatment done wrong or overspend money or anything like that. Again, the purpose of this live stream and our whole YouTube channel is just to educate people and just to help them out. That's why we're very transparent. We talk about the why, the how, the what we do, material. We answer every question that's asked. So please hit that like button. It's free.
Yeah. Yeah, and we appreciate our viewers and and the questions that you're asking. We appreciate the fact that we're able to do this, that we have the technology to do this, and the skill set. So thank you all for watching this morning, and moving forward, we're gonna start at 9:30. So the future live streams will start at 9:30. It takes a little while for us to set everything up. So we'll look forward to you joining us with us next week. I'm Dr. John Willardson here with Dane Willardson, Memo Hea, Trust Implants, trustimplants.com. And thank you all for watching, and we'll see you next week.